In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
Joining me in the studio is Professor Torsten Bauer, lung specialist from the Helios Clinic Emil von Behring here in Berlin. Welcome, Professor Bauer, to the show. Hi. It's pretty alarming that those last resort drugs are used more often and often. So does it mean we are turning back to the medieval times where we don't have antibiotics available at our hands?
No, I don't think so. Resistance of microorganisms is a natural phenomenon. When we introduced penicillin, for example, in the early 50s, we had the first resistant microorganisms in the 60s. So we have to deal with it.
Yeah, and the bacteria are dealing with that as well on their side of the story.
They have their chance.
So how big is the problem of multi-resistant drugs?
Well, it is a big problem all over the world, especially when it comes to tuberculosis. There are different rules in tuberculosis. But within the hospitals, we do have multi-drug resistant infections.
And can you say how many people die from multi-resistant bacteria worldwide?
It's very difficult to say, except for tuberculosis, because patients who acquire multi-drug-resistant microorganisms in the hospital usually have another problem. Whether they die from this infection is difficult to say, but it's a couple of thousands every year.
And if you look worldwide, are those germs found all over the world and are they equally distributed?
No, definitely not. Tuberculosis is not equally distributed over the world, and we do have multi-drug-resistant organisms in the hospital in the very developed countries. High developed medicine, we do have these problems.
And some countries, even if they do have high developed medicine, have lower rates of multi-resistant germs. So what are they doing right?
There's always a problem of the hygiene. When you have, for example, in Holland and the Dutch countries, they do have a very low incidence of MRSA, the multi-drug-resistant Staph aureus, in their hospitals. And they have limited access to their intensive care units, and they take time to see whether the patient is colonized with this organism.
So what do you mean they have limited access to their intensive care units? They surely put patients into ICU if they needed to be there.
Yeah, but when you come off the road, for example, with an accident and you need to have access at 11 o'clock at night, they put you in a special room. They take their time to see whether you have superbugs on you, and when it's negative, you go to the intensive care.
And if you caught something like a superbug, can you get ever rid of it?
Yeah, the immune system usually paralyzes these microorganisms very fast. For example, doctors are probably colonized with those microorganisms but never get sick because of the good work of the immune system.
You already told us about tuberculosis, but there are certainly other diseases which you can get with multi-resistant bacteria. What kind of diseases are there?
Well, number one is nosocomial pneumonia, so the lung infection you get when you're mechanically ventilated on the intensive care unit.
And what about wounds and stuff like skin infections?
Skin infections are a problem always when blood doesn't get to the site of the infection. Like, for example, if you have diabetes and your vessels are very small and you don't have a high blood flow in this area, you get multi-drug-resistant infections there.
Professor Bauer, what do you think? Is plasma the next new big thing in medicine?
Well, it's a fascinating method. It is a answer, but not the answer to soft tissue infections.
And it's just used for superficial disinfection, or?
Well, superficial disinfection is not a problem. If you have an antibiotic surface like a table, you can disinfect it. It is always when you have a wound infection, the question, how far goes it into the tissue? And this is also the question you have to ask to the plasma researchers.
So what other methods are available in treating, for instance, wounds with multi-resistant bacteria?
Well, there are fascinating methods around. For example, also bacteria can get diseases. For example, there are a couple of viruses that kill bacteria. So far, we do have some results with these infections of bacteria, but it's very hard to control.
So you're putting an infectious virus onto a bacteria and hope that they fight it off?
They do, but they usually also fight human cells off. So the answer is not exactly that what you want to have.
Okay. We got a viewer question. Roy from India asked whether antibiotic-resistant bacteria can killed by UV light or LED light or simply by boiling water.
Yeah, there's absolutely no difference in the killing techniques for bacteria, whether they're drug resistant or not. Usually, hot water is the perfect physical method to destroy bacteria, no matter whether they're resistant to antibiotics or not.
How much do I have to worry? Is a healthy person really likely to get some multi-resistant bacteria from just eating meat?
Well, if you don't cook it, you will get these microorganisms. But you will probably not even get sick when you're a healthy person and the bacteria count is not high.
So it's usually safe if you cook it and if you wash your hands.
Yeah, what she showed is she washed the meat, so she reduces the number of bacteria on the meat. But what you should never do is you should never prepare poultry on a wooden plate and have the salad afterwards on it, because then the salad has the multi-drug resistant organisms on it.
It's contaminated and gets all the germs. And what about all those antibacterial dishwashing liquids and hand soaps? We got a viewer question about this. Our viewer Senkim Timne from Cambodia asked if they could perhaps contribute to the problem.
They do. They do. They go down the drain, they get diluted, and then they don't have the killing effect anymore, and they introduce antibiotic resistance or resistance at all. So I don't recommend to put anti-disinfectant into the soap.
Okay, so you don't even, as a normal, not as a doctor, but for normal people, you don't have to wash your hands with alcoholic solutions?
No.
Okay. We got a viewer question from Uruguay. Maria Brinkhorst says her doctor prescribed penicillin for a throat infection, but it didn't work. She asked if she herself is resistant to penicillin right now.
No, it's always the microorganism that gets or develops resistance. In this special case, probably the throat infection was a viral infection. That's why penicillin didn't help, which doesn't mean it doesn't help the next time.
But can you, as a patient, do something against developing multi-resistant germs?
Yeah, you have to be critical in using antibiotics. If the doctor prescribes antibiotics, you have to take them for a certain time, and you shouldn't repeat the same antibiotic within a time frame of about 30 days.
So always stick to what your doctor says then?
Well, helps sometimes.
Helps sometimes. So, and what do you personally do to not catch any multi-resistant germs?
Well, I am a doctor. I work daily in a daily routine in the hospital. We disinfect our hands after each contact with the patient, and I wash my hands before I go home. That was enough for the last 20 years.
Professor Bauer, thanks so much for being with us. Okay, thank you so much.